This is the Jesus take the wheel moment. I grew up with a passion for horses. The people that taught me the most about riding and horses themselves were the grooms. Their job was to take care of show horses, and they became my mentors. They also unknowingly ignited a spark for the work I do today. On occasion, I saw these men address their healthcare needs through traditional medicine, medications brought from Mexico, or when the issue was really severe, a consult with a veterinarian. Based on my limited life experience as a young person, I wasn't able to fully grasp their decisions. But one person, Ernesto, who taught me confidence was key to working with horses, died from a treatable infection that he developed from a cut on his leg. One of my first professional roles helped me connect those issues that I saw among Ernesto and his peers when I started working to provide health education to migrant farm workers. They helped me understand the complex relationship between health and citizenship and environmental hazards, access to medical care, and trust in people and systems that they represented. My experience shaped my personal vision of health, equality, equity, and social justice. The people that allowed me into their lives propelled me into a career of designing healthcare made to meet people's needs, to meet people where they were. Eventually, I got to work with people with HIV in the early 90s. That's where it all came together. Policies, practices, people, in ways that forever changed my take on how I've approached my work. I was taught the importance of healthcare with dignity and respect from Chris, who was only permitted home to die if he told everyone he had cancer, and Tim, who left a life and a partner he loved to come home and care for an aging mother, only to die before she did at age 37. This important difference between equality and equity just became more and more clear as my career advanced. The idea that some of us will need something more, something different, something special to achieve our best health really helps us frame our work around equity. And to shy away from that will always leave somebody out of the equation. Today, I work in a community health center. I found my tribe, and I have been grounded in supporting the practice of family medicine ever since. Family medicine providers are trained to consider the family as a unit, the community and systems, and their impact on individual and family's health. While the U.S. continues to undervalue and underfund family medicine, we are fueled in my organization by the evidence that we see in our patients' health outcomes every day. Access and engagement with family medicine makes for a healthier community. We also have the opportunity to put the body back together, to address issues of the mind, the heart, and the teeth, all under one roof, most likely, to help people be seen as whole people and to understand that health in one area of our body impacts health in our whole body. One of the things that we've worked to learn over time is how to extend ourselves beyond the exam room. We believe and we know that health happens in communities and homes and workplaces, and the evidence supports that. Most of us think that the access or the magic happens when we're sitting in an exam room with a physician. The evidence tells us that actually that's only about 20% of what makes up overall health. The things like health behaviors and our decisions, socioeconomic factors, drive our individual health and so community health. In 2009, we had an historic opportunity as a country with the largest legislation ever written to address health and health care in our country. While it was very messy and imperfect, it did prompt us as healthcare providers to again think beyond the exam room, to think about how we move out into communities, how we engage folks, how we understand our neighbors, how we deploy folks like community health workers and health promotoras who are from the communities to address health issues with their neighbors. In addition, we found that if there's a problem, like in this instance, that children aren't receiving dental care as recommended, we have an opportunity to think differently. In that case, we knew that was a fact in our community, and so we partnered with schools and now deliver care to over 4,000 young people in their school setting every year. This changes the trajectory of a young person's life when they can put their best smile forward and understand how their oral health is related to their overall health. All of this work around disparities and creating and designing systems, we didn't know then, but we know now, was clearly a dress rehearsal for a modern day pandemic. All of the things that we saw our patients and the communities that we care about struggle with came to the surface forced by this pandemic. We saw our patients load into vans to go to work and unfortunately bring COVID home to their family members and their friends. As a team, we gathered together and we started redesigning the plane in mid-flight. We started figuring out new ways to deliver care. We started mailing masks to people who were immune compromised. We thought through everything possible to make our patients able to live healthier through this pandemic. Some days it's a little exhausting, but I do believe that the future is bright. When I question myself, when I question do I have the right skills to lead an organization forward in this circumstance, I think about many things. I think about my team members that I love, I think about our patients, I think about my own kids, and if I ever get too tired, I just look at these smiling faces and know that their dreams, that their expectations of us are never ending, and we all have to deliver for them. Thank you so much.